All right. Welcome to Ask Dr. Jason number 2. We are here. It's Friday at 12 p.m. Pacific Standard Time in sunny LA. I'm here to answer your questions on health, on healing and alignment, mind and body, spine and mind. Let's roll. Savannah, do we have some questions today?
Yes, we do.
Come on. What do we got? Number 1, who is it?
Okay, first question is from Arnold.
Arnold. All right, so let's hear what Arnold has to say.
Arnold says, is it okay to align my back by twisting or with help from a friend? I'm a student that sits for hours and am in frequent back pain.
Okay, so Arnold, we actually did an Instagram post on this and we did a spine. Where's that spine? Hey, would you be so kind to grab me that spine from the front room, brother? So we've got an Instagram post on this, but basically if you're trying to align your own spine, the answer is no, it is not okay, and here's why. When your vertebrae is out of alignment and subluxated, it is stuck. When it is stuck, the vertebrae above and below will move too much, and when that happens, when you're popping your own back, not only are you stretching ligaments in your spine, but you are also moving vertebrae that do not need to move. So you are creating hypermobility. No bueno. Get to a chiro. Thank you, Arnold, for the question. What else do we have, Ms. Sav?
Okay, second question is from Cachette.
Cachette. All right, Cachette is in the house. What do we have from Cachette?
She says, for a few years I've had bad headaches and
Come
neck
on.
pain.
Thank you. We got the spine right here. There we go. Okay, so for a few years, Cachette has had bad headaches and neck pain.
She
Okay.
wants to know if they're connected.
Excellent. Okay, so what we have found is that headaches are almost always caused from the cervical spine. Now, there are other causes of headaches, ranging from dehydration, fatigue, blood pressure issues. There could be dietary causes. There's really a lot of causes of headaches. But the simple answer is that yes, many times headaches are caused. They're called cervicogenic, generated from the cervical spine, and they're caused by the vertebrae in the neck being subluxated or out of alignment. So I would definitely recommend getting to a chiro again and just getting checked for subluxation. So thank you for writing. We hope your headaches get better. I've helped a lot of people with headaches. Next, what do we got, Miss Savannah?
Next question is from Anessa.
Anessa. All right, Anessa, what do we have from Anessa?
She's asking, how old do I have to be to see you to have you crack my bones?
Wow. Well, Anessa, thank you for announcing the question. Look, the truth is we don't actually crack bones. I definitely crack my eggs in the morning if I'm making some eggs, but we don't crack bones. What happens is when we adjust you and we put a force into your spine, it gaps the joint capsules in the spine, creates a pressure differential from the outside atmosphere and inside the joint itself. That creates a sound, and it's a release of nitrogen gas. So a lot of people think chiropractors work with bones, and we're bone doctors because we use the spine, the bones, to manipulate and affect the nervous system. However, the truth is we are more neurologically based than anything. So you don't have an age limit. If you have a spine, we can check you for subluxation, for a change in tone in the spine. We want to make sure you're balanced between your gas pedal and your brake pedal in your nervous system. So my son, Jack, is 8 years old. He's been checked and adjusted since his first day of life. I will tell you that the younger you are, the more gentle the adjustments are. So get to a chiro. All right, next, Sav, what do we have?
Next question is from Jesse, and Jesse wants to know, is chiropractic safe?
Ooh, all right, Jesse. So many people ask if chiropractic is safe, and that's a great question. Statistically speaking, you're more likely to get injured driving your car down the street, flying in an airplane, than you are from a chiropractor. Another way to look at it very simply is that chiropractors, we typically pay about $200 or $300 a month for our malpractice insurance. In other words, we don't hurt people. The average medical doctor typically pays around $500 to $1,000 a month. A plastic surgeon may pay anywhere from $1,000 to maybe $4,000, $5,000 per month, and that's without any incident. I've been taking care of people for 14 years, including my residency, never had an issue. So God bless, chiropractic is safe, and statistically, again, you've got anywhere from 10 to 15,000 people a year dying from taking non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, from liver and kidney failure, and those are over-the-counter medicines. And there is nowhere near that, if any, people being injured or ill or death from chiropractic care. So it's incredibly safe. Thank you for the question. What else we got, Sav?
Next question is from Caitlin. Caitlin wants to know, is chiro care appropriate for children?
All right, amazing. Well, that's a great question, Caitlin. As I mentioned, I've been taking care of my son Jack since his first day of life. My daughter Jayla, my daughter Victoria have been taken care of for years. Same thing from right when they were there. And it is absolutely appropriate for children. As a matter of fact, if you see kids playing, my son Jack plays basketball. Many times in ball, it's a contact sport. He's fallen down, he's roughing up, hitting his head. Many children fall and get injured, actually more so than adults. So chiropractic care is not only appropriate, it's absolutely vital unless you want to live your life with your spine out of alignment, and then that can cause various problems. And many children, I'll just say this, Caitlin, many children, and this was certainly myself when I was a kid, go through life with problems. I had stuffiness and allergies and difficulty focusing, and it wasn't until I was 16 years old that I got an alignment in my cervical spine, my neck, and all of a sudden my allergies went away, my stuffiness went away, and my focus became very clear. And so many children, many kids, many teenagers are suffering from the inability to focus in class, or they're having headaches all the time, and they're 12 years old, they're 10 years old. And if you don't correct the spine and you just give medications to treat symptoms, and you never get at the underlying cause, then many people are going to suffer and they're going to live a life less than they deserve. So it is absolutely appropriate for children to get checked by the chiropractor and adjusted if necessary. Awesome. Next question, please.
Next question comes from Dylan. Dylan wants to know, how do I choose a good chiropractor?
Awesome. Now, hey, really quick before we answer Dylan's questions, the way we got all these questions, people are tweeting us on Instagram. I'm at Dr. Jason. You guys can find me there. You can DM me questions. You can leave questions in the comment section. If we are on Twitter, I'm at Dr. Warrell. Just put the hashtag AskDrJason. What we do is Savannah helps out. She writes down the questions all week long. We get patients in our office, practice members asking us questions. We write them down. So if you have a question on health, on healing, on alignment, chiropractic, mind, body, you give it to us. We'll answer it. And Dylan's question again was how to find a good chiropractor?
Yes.
Amazing. Okay. Number one, chiropractors, what we do is we locate, analyze, and correct vertebral subluxation spinal misalignments. What I do is I offer options to address the principal causes such as poor habits, poor decision making, and poor thinking, to be honest. And so what you want to do with a chiropractor is you really want to find somebody that, number one, can locate the subluxation. So in our office, we use a nervous system scan. We're actually measuring what's called heart rate variability, how much your nervous system is in balance, gas versus brake pedal. That's huge for healing. Number two, we do a thermal scan of your spine. We measure how your nerves are flowing with a thermal scan. Number three is we do a muscle EMG to see how much energy your muscles are generating via the nerves. So our analysis is very thorough. Then we perform a chiropractic exam where we check the spine by hand. Chiro means by hand. Chiropractic means done by hand. Then we take any necessary x-rays. So we're incredibly thorough. Our new patient consultation is anywhere from 30 to 60 minutes. So number one way to find a good chiro is to find somebody that's thorough and that actually checks the spine for subluxation. Number two is that we take pre and post x-rays. So we actually do corrective care. We look to see a change. You want to get somebody that's thorough. And number three, last but not least, you got to be able to adjust. Chiropractic is a manual, coordinated skill. If you get somebody, and there's different techniques, there's lower force and higher force velocity techniques, but you've got to get somebody that can adjust and can adjust specifically. Some docs out there may not be as specific as others. Hey, everybody's trying to do a good thing, but make sure you find somebody with a proper analysis and then that can adjust you appropriately and then checks you to see how you're doing. Amazing question. Next, Savannah.
Next question is from Jessica, and Jessica's asking, what is the popping sound when you get adjusted?
Come on, all right. Savannah, great job rounding up the questions. Jessica wants to know what's that popping sound. So again, each vertebrae has 6 articulations. It's got 2 joints at the top, 2 joints at the bottom, a disc below and a disc above. And that popping sound is a release of nitrogen gas from what we call the facets, those 2 below and 2 joints above. So you can actually get 6 releases from 1 joint. Sometimes people feel like my whole spine moved. It could be just 1 or 2 vertebrae. But that popping sound is a release of gas. It is not dangerous at all. Thank you. Next question.
Okay. Last question is from Tiana.
Tiana, all right.
Tiana is asking, is it safe to come see you if I'm pregnant?
Oh, come on. Well, right now at Active Health, we have a handful of pregnant women. We're very blessed to take care of them. I've taken care of my own wife during pregnancy of our children, and so it is absolutely safe. And one thing about chiropractic, a lot of women say that, the belly is carrying the baby. Well, in actuality, it's really the pelvis and the spine that carries the weight of the baby. And what happens during pregnancy is that typically the lumbar spine will deepen in the curve, the pelvis will shift forward, and as you can see, that jams and puts a lot of pressure on the joints. And what that does is it can inflame and cause problems with the nerves that go to the reproductive organs and go to the uterus, the ovaries, and the uterus is where the baby is, so that can negatively impact the baby. In addition, the muscles of the pelvis, the hips, the legs, the lower back can get really tight, and many times in a woman, as her chest grows in order to nurse the babies, what happens is the upper back can get weighed down like so. Meanwhile, the pelvis is getting pushed out like that, and it can create a lot of strain on the spine, which can adversely affect the nerves. So not only is chiropractic safe for pregnant women, many times pregnant women report actually an easier birth, a more smooth pregnancy, and it's a beautiful thing. So I would absolutely go and get checked. Again, find a chiro that's experienced taking care of pregnant women. And of course, we don't x-ray pregnant women, but we do perform the heart rate variability thermal scan and EMG. It is totally safe, and most women report an easier pregnancy, so that's an absolute blessing. All right, guys, thank you so much for tuning in. This is Ask Dr. Jason. Just gonna check really quick if we've had any additional questions pop up. And if you have a question, you can email me, drwarrell@gmail.com. You can tweet us out at Dr. Warrell and just put hashtag AskDrJason. You can DM us on Instagram. We appreciate you. These get uploaded to YouTube, so you can find it on our channel there, youtube.com/drjason. Thank you, much love and appreciation for you. And my question to you is, who's your chiro? If you're in LA, it's me. Come on.